And now I'm talking to Breda Gahan, the Global Health and HIV and AIDS Programme Advisor at Concern Worldwide. Breda, how's it going?
Thanks,
Breda,
Darren.
congratulations first of all on winning the Dóchas Global Citizen of the Year award. I saw photographs of you with the award, and the award looks like a physically beautiful award. I presume you're very happy to receive it. Yeah?
Well, thanks very much, Darren. Yes, I was a bit shocked to be nominated and then particularly to win. But I guess I accepted this as an award for all the people who were nominated. In fact, there were 4 other women. And really for me, it's an award for my work with Concern and for all people in Concern, especially people overseas who work at the front line. And yes, the award, in fact, was made by an Irish artist. It's up in my office, so I'll show it to you after this interview.
Right.
It's a beautiful piece of work.
Yeah, I'd like to see that. Yeah. Just talk about the topic we're here to talk about today, and related to that, the award as well. Could you tell us how you got involved in the work that you do now, please?
Well, actually, when I was in St. James's Hospital, I got leave of absence for 2 years and went to work in a hospital in Baghdad in Iraq, which was very interesting but difficult during the war.
This was the first Gulf War, was
This was the Iran-Iraq War, actually,
yeah.
the end of the 1980s. And it wasn't that the work in the hospital was that difficult. It was quite amazing. A 3rd level referral hospital, beautiful equipment. But I couldn't believe that out in the villages and the rural areas, despite the fact that Iraq was selling oil, I saw so much polio. I'd never seen polio before. And I learned that that was prevented by an oral vaccine. And when I came back to St. James's Hospital after 2 years, then I was working on the oncology, hematology, bone marrow transplant and HIV and AIDS unit. And after 2 more years there, I thought, like many teachers, nurses, engineers sometimes do, maybe I'll do 2 years volunteer overseas. And I joined Concern in 1988, 27 years ago. And the first country they asked me to go to was Sudan. So it was an Arabic-speaking country where I learned Arabic. I was living in the Blue Nile province. And again, I saw issues of polio, childhood malnutrition, particularly difficult situations in terms of unsafe delivery, high maternal mortality as mothers were dying in childbirth. The rural health system was particularly poor, and it was a very difficult place for children and young girls and women in particular. I had intended doing just 2 years in Sudan, but somehow then I was asked to go to Cambodia at the end of 1990, and I spent 3 years in Cambodia, and then I did a master's, and then I spent 3 years in Mozambique. And then I was working supporting programs for my New York office, child survival programs in Bangladesh, Rwanda and Ethiopia. So I'm a nurse midwife. I've always worked in the health, particularly preventative health protection side.
I thought you actually focused on HIV and AIDS, but it's global health in general, is it?
Well, no, after I had worked then on child survival for 4 years, that was up to 2002. Since that, for the last 10 years, I've been working exclusively as the Global HIV Programme Advisor in Concern, based especially on my experience all those years ago, and I still have my contacts back in St. James's Hospital. That's correct.
That's great. Could you tell us where you work today and how? And could you tell us how the HIV/AIDS situation has really changed in Ireland and internationally since you first started working in this area?
Well, the biggest change is that even when I was working in St. James's Hospital on the HIV part of the oncology hematology unit, sadly, everybody infected with HIV at that time died. There was no treatment. There is still no cure, but treatment has advanced significantly. And especially in northern countries and more wealthy countries like Ireland, we can treat the opportunistic infections. And since the middle of the 1990s and the millennium, with the advancement of antiretroviral therapy, people are living a relatively normal life in countries like Ireland, England and the USA. The sad situation is in poor developing countries in Africa and in Asia, and I've recently come back from Mozambique. People don't have access to the medication that's life-saving, that gives them life. Life expectancy in Ireland now with HIV is the same as anybody else. You're as likely to die of a car accident, heart disease, cancer, smoking-related illnesses or whatever. But unfortunately, the disadvantage for people in rural poor communities or urban slum areas is extreme poverty hasn't changed as the main driver. The whole area of inequality, and especially gender inequality, the difficulty in terms of injustice, lack of access to treatment. Health systems aren't working in rural poor areas, and we've been hearing recently what the Ebola virus has done to health workers and the health system in Sierra Leone and Liberia, where concern is working. So without a good, robust health system to test and treat people, their outcome isn't so fortunate as for people who live in Ireland. But incidents and new infections are increasing globally at a low rate in Ireland, but I just checked before I came to meet with you, Darren, and already this year in Ireland, week 48, there have been 469 new diagnoses of HIV in this country. That's up on 120 for the same period last year. You might say that's not a huge amount, given that globally 37 million people are infected with HIV today. And last year there were 2 million new infections. But still, it's a big burden in terms of the stigma attached. People have to take treatment for life. Food remains the first medicine, and this is an issue for people, again, where there's food insecurity and drought, and now we're hearing of the issues with climate change, with the Paris conference going on. Where people don't have access to the basic services, they're not as likely to live as long as people in countries like Ireland.
Yeah, I've read once or twice. I think this could contradict something what you just said a minute ago, because I might have read it wrong. But I read once or twice that we have reached a tipping point with HIV/AIDS. Is this true, and could you explain it, please? And is it true to say that the targets for the Millennium Development Goals have been met for HIV/AIDS?
Well, to start with the targets first, they've been somewhat met. I mean, the target for MDG 6 is to halt and reverse the spread of HIV and AIDS by 2015. So in some countries, the rate is slowing down and more people are on treatment. And if I'm living with HIV and on treatment, I'm less infectious, so less likely to pass it on to other people. So in parts of the world, you know, we are achieving MDG 6, particularly in North America, Europe and Ireland. Also, the number of new infections has fallen. It was in the mid-1990s, 2000, up to 3.5 million new cases a year. Now it's down to 2.1 million. But that's about half the population of Ireland all the same. In terms of the tipping point, we will reach the tipping point when more people are on treatment for life than are being newly infected, which means we get beyond the curve of the epidemic. But currently, only globally, 41% of adults and 32% of children are on treatment. So when I look at this slide here, I see the huge treatment gap. And the big gaps are in poorest countries in Africa and in Asia, where concern is working. Everybody has a right to treatment for life. The World Health Organization now advises that as soon as anybody is diagnosed, and testing is the gateway to treatment, immediately start treatment. But currently, 59% of adults and 68% of children do not have access to treatment. And many of them have never been tested. In fact, 17 million people who are living with HIV globally currently have never been tested and don't know their status. They probably think they might have a bad flu, TB, diarrhea disease, malaria. They'll think many things, but like in rural Zambezia, where I was last month in Mozambique with the Concern programme, there are no testing services in rural disadvantaged areas. So the main focus now has to be get people tested and get them on treatment so that the global amount of virus in the world is reduced in terms of HIV. But the treatment works. I've seen what's called in Africa the Lazarus effect. Literally, some people brought on wheelbarrows to the clinic for treatment a few weeks later, and especially if they have access to some nutritious food, they do get back on their feet, start walking, and are able to work again.
Yeah, I read an article. A senator in Ireland, Afro Power, went. I think it was Mozambique a couple of years ago, and she was saying that she saw, which on her first day there, a woman arrived and she was really unwell, and she was kind of afraid that she was going to die. But the nurses were actually confident, no, as soon as she starts treatment, she'll be okay. And then within a short space of time, she was healthy again. Like, it's amazing.
It's amazing. I mean, you know, he has talked about his diagnosis recently on television, Panty Rory O'Neill.
Oh, yeah.
And I mean, he's living a healthy, normal life, but it is treatment for life. And if people stay on treatment, they are less infectious. And in terms of rights and responsibilities, I believe people have a right to testing, a right to non-stigma, non-discrimination, a right to treatment for life, but also a responsibility to stay on treatment so that they protect themselves and protect other people from infection. I mean, it's still unbelievable that yesterday, today, tomorrow, over 5,600 new infections a day globally. That's a lot of people. And unfortunately, the biggest increase now is among young people, 15 to 24-year-olds, because they don't remember poor old Freddie Mercury that some of us are old enough to remember. Maybe the film Philadelphia. My mother remembers Rock Hudson. Who else can I think of? Young people just don't remember. Even in Africa, they don't remember all the coffins.
American rapper Eazy-E.
Oh, that's right, yeah. Eazy-E. And that basketball player, big Magic Johnson.
Oh, yeah.
So for people who are adhering to their treatment, the treatment works. And increasingly, I was with 2 pharmaceutical companies earlier last month. Treatment is being used for prevention in terms of PrEP, pre-exposure prophylaxis. It's a little bit like the contraceptive pill. You take the treatment before you engage in risky sex to prevent yourself being infected with HIV. And then also, if somebody has unprotected sex or steps on a needle that might be infected with HIV, there's what's called PEP, post-exposure prophylaxis. And that means you have the test from your GP or the hospital, St. James's, Mater. You stay on the treatment for a month and you're unlikely to contract HIV, post-exposure prophylaxis. And then the most important prevention is, and this is really important for me as a nurse midwife, people living in Africa and Asia, prevention of mother-to-child transmission. Now, it's hard to see this with the colour, but if a mother is HIV positive, there's a chance of between 10 and 30% that she will have a HIV positive baby.
I thought it was 100%.
No. Oh. Thank goodness not. It depends on many things. The health of the mother, her nutritional status, how much virus she's carrying, where did she get the virus, is her husband infected or partner. So it's between 10 and 30%. So you see here the little t-shirts of the kids. There's 35 of them will be infected if there's no intervention. They'll get infected during pregnancy, labour, delivery or breastfeeding. There are the 4 routes. And obviously, every mother wants to have a HIV negative baby, even if she's positive. With intervention in terms of treatment to prevent mother-to-child transmission, we're reduced to, and it's still not good enough, but it's significantly reduced, down to 5 children who will be infected through pregnancy, labour, delivery, breastfeeding, which
That's
is
amazing. Yeah.
And in Ireland, we're so successful in this area, we're less than 1%. Because, you know, our hospitals are very good. I trained in the Coombe Hospital here. So
So
with
it was
successful intervention, I was born
Oh
during
my
time.
God! I was born in '81. We're going off topic now, but
Yeah.
were you a midwife in the Coombe then?
I trained in the Coombe 81, 82,
Oh
yeah.
my God! You could have delivered me.
I could have.
No, we're
Is
really
this-
going off topic.
Is this on live radio? Wow,
No,
yes.
Yeah.
I know I look too young, but yes,
Yeah.
I trained in the Coombe 81, 82, yeah.
God, that's amazing. Yeah.
I trained the matter 77 to 80.
Oh God! And I'm not even from the south side, and I was born in the Coombe. I'm from the north side.
It's a great hospital, they do great
Yeah.
work there, and they still do great work in supporting all mothers, but especially mothers who are positive, so that they can have a HIV negative baby. And in concerns work, this is why we're supporting to strengthen the health systems in poorest countries, so that the nurses and the midwives there are able to support mothers to have negative babies. You know, we want to have a virus-free generation. The theme for World AIDS Day for the last 5 years has been getting to zero. You probably heard about that. Zero new infections, zero discrimination, and zero AIDS-related deaths. So, you know, everybody's calling for no complacency. And sadly, it's complacency that's allowing new infections to occur. I mean, why do we have 469 new cases diagnosed in Ireland this year alone? And they will need treatment for life. And it's not just the cost of the medication, it's all the laboratory tests, the follow-up, the health staff, the hospital, the lighting. You know, there are a lot of costs. It's an expensive disease to treat, even though the drug prices thankfully have come down.
I read that article you wrote for World AIDS Day on the what's called Dóchas website, and I've read other reports over the last few years. It's true that gay people constitute something like over 40% of new cases in Ireland, don't they?
Yes, men who have sex with men or gay men are increasingly highest incidence in this country. There's been a slight increase also among intravenous drug users who share needles or use infected needles. And, you know, there is a significant increase also among the heterosexual population. So it's among all groups. But you're right, especially young gay men, they don't remember the sad days, the bad days when poor old Fab Vinny, who you're too young to remember, he was in St. James's when I was working there. You know, they don't have fear. And they don't see the pictures of slim disease anymore, people really thin. I mean, any of us could have HIV and we look the same as anybody else nowadays. So they don't have the fear, and we need to support responsible education. I met with our new health, well, he's not our new health minister anymore, but Mr. Leo Varadkar on World AIDS Day. And just a week before, he has launched the first ever national sexual health strategy for Ireland. You know, education is the social vaccine, as Father Michael Kelly in Zambia says. And the Father Michael Kelly Irish Aid lecture is in the Royal College of Surgeons tomorrow. Everybody is welcome from 5:30, I think it is, to 7 p.m.
What's he talking about, HIV?
Well, he's by video because he lives in Zambia and he isn't so well himself, but there are two guest speakers, one from Botswana and one from Ireland, a sister who's been working in this area for many years.
Yeah, I just have. Are you talking about the HIV picture in developing countries in Africa? Are they?
Yes, in light of World AIDS Day, which was December 1st.
Yeah. I just have two more questions for you. You can say more if you want to, but we could be talking all day. How quickly is treatment expanding in developing countries? And we still have the Millennium Development Goals, but they expire at the end of the month. And from next month on, for 15 years, we have the Sustainable Development Goals for 15 years. Are you confident that we can have an AIDS-free generation by the end of those goals in 2030?
Well, looking back over the last 15 years, the millennium doesn't seem that long ago. And it's brilliant that over 15 million people are accessing treatment. But it's very sad that 17 million people either haven't been tested or have been tested and don't have access to medication. I would hope that, you know, the global the global citizen, will act on our responsibility and support people's right to get access to treatment. It's in everybody's interests. the impact and the cost of HIV is felt at the individual level, the family level, the community level, and the country level. We know how to do it. Leadership, I think, is waning somewhat in Africa and in Europe. It's no longer the hot topic. Climate change is the subject of the moment this week, and rightly so, with what's going on in terms of the conference in Paris, and due to the abject adverse weather effects we've been exposed to here, especially in the west of Ireland and in northern England this week. But in Mozambique, where I've come back from, I mean, drought is affecting food production and agriculture, and the El Nino effect is expected to have an impact on productivity for the rest of this year and early into next year. And if there is a lack of food, especially women engage in risky sex to get food on the table, people will do anything to feed their children.
It's amazing, like it's unbelievable really, like I'm constantly reminded of, I constantly have to be reminded of when I see a map of how big Africa is. Like one of my regular interviewees, Circa Nick Rihanna from Oxfam, she was in South Sudan there. I think she's there once or twice but in the last year or two. But like I always think of it as being a small country, but it's actually the size of France. Like,
yes.
It's unbelievable.
Mozambique, where I've recently returned from, is 11 provinces.
Yeah.
Each province is much bigger than Ireland.
Jeez.
And
I always thought
it's a big,
country.
Long country.
Oh my God, yeah.
On the East Africa coast.
Yeah.
I lived there for 3 years, from 95 to 1998. And sadly, when I look at the statistics now for Mozambique, I mean, Gaza province has an adult prevalence of 23%. That's almost 1 in 4 adults that are infected with HIV. Okay, the province with the lowest prevalence is Niassa, where Concern was working in the past, 2.5%. So even within a country, you can have very different prevalence and incidence rates.
Yeah.
And as Bishop Tutu and UNAIDS say many times, to know your response, you need to know the epidemic. We need to predict where the next infections will come from and target stopping them in those places.
Okay.
And, you know, thankfully the surveillance and the estimating of prevalence and incidence in each country is increasingly being disaggregated down to province, region or district level. So we know more and more where the risk and vulnerability is and where people are getting infected, why, how. Unfortunately, the response is not matching what I see the research is telling us. And the research, it all depends on resources. I mean, billions of dollars will be required to ensure that everybody who's currently infected, even if infections stopped today, to get treatment by 2010, 2020, 2030. I mean, the good news is, Darren, that, you know, technically HIV is 100% preventable. Technically. We know how to prevent it. It can be interrupted. Luckily, it's not like Ebola in terms of its virulence. You know, it's quite hard to contract HIV. Through intimate sex, dirty needles, where a mother is infected, passing the virus to her child, unclean, infected blood transfusions. It's not like the flu or TB or other airborne diseases. So the good news is that I always end up saying, you know, HIV, hope is vital. And if each country takes the leadership, and with the support of donors, including Irish Aid, which has been very good in supporting Concern's work with other donors, we can help governments, populations and communities to stop the spread of HIV. So I certainly hope that my job, I'm in a different role in 2030. And that HIV and AIDS has stopped spreading. But I do worry, if complacency increases, then more infections will happen. Just like we're seeing in Ireland. I mean, we have to ask ourselves, you know, why is the education not reaching young people, or are young people not acting on that information? Something is not working. And yet the theory tells us we know how to prevent HIV. Now, and there might be progress in vaccine, but I don't hold my breath anytime soon, because there's not just one HIV virus. There are several subtypes and different clades of the virus. So there are many HIV viruses. So even if we developed the vaccine for one type, it wouldn't prevent against another type.
Yeah. I had a couple of questions asked you, but you've kind of answered them already.
Okay.
If there's anything else you want to say, you can go ahead and say it. Just for our listeners who are listening now on radio or on podcasts on YouTube around the world, and want to help you in Concern, like could you name, along with Concern, the other organisations who accept donations from the public, like, to help? Because I presume that's a great way to help.
Well, absolutely. Well, thanks for asking that, Darren. Yes, obviously Concern, through our monthly donations, through voluntary donations from the public, support all our programs. And particularly in the case of HIV, we integrate response to HIV in all our sector work, in health, in education and in livelihoods. Most of the other organisations that are members of Dóchas, like Trócaire, Oxfam Ireland, Mission Cara, Plan Ireland, Goal, who else? Action Aid Ireland, Christian Aid Ireland, almost all the organisations, just as does Concern Worldwide, integrate the HIV response in our work, because we realise we will not deliver and achieve our expected results in any sector programme if we ignore HIV and AIDS, especially where the impact is very high. And at the moment that remains, it's too difficult here to see the map, but the burden still is East, Central and Southern Africa. There has been increases also in Asia, and the fastest growing epidemic now is in Eastern Europe and Central Asia. But in terms of total numbers, it is in the countries where poverty is deepest, where there's Sub-Saharan Africa, where there's greatest inequality and injustice in terms of lack of access to safe health systems that can support people to get tested, to have knowledge about prevention and to start on treatment if they are infected.
Yeah, and the Dóchas have a committee, don't they, to work on this?
Yes, I'm a member, a former chairperson of the Dóchas HIV and AIDS working group. It's on the Dóchas website, so if anybody has questions or wants further information, they're welcome to contact me. Breda Gahan here at breda.gahan@concern.net as my email address. Mention the programme, so because I get so many emails, so I can follow up. But people are very welcome to communicate and ask questions, and we'll do our best. I do have access to all the latest reports that always come out towards the end of the year. Another one came out yesterday from the World Health Organization, which is very comprehensive. So if people have different needs or different requests for resources, I can help them. And there's also a new website in Ireland called HIV Services Ireland, HIVservices.ie.
And there's HIV Ireland as well, the organisation.
That's the former Dublin AIDS Alliance. Yes, that's here leading with support in Dublin area. And for the whole country, there's HSI, HIV Services Ireland. And that website will show you all the different places for testing, for treatment, to address stigma discrimination, psychosocial support, and any other queries. The national helpline number is also there.
And I read recently during the week that HIV Ireland are actually going national now. You heard that?
Yes, they are supporting in areas, because there are national organisations already in Cork, in Limerick, in Galway, in Belfast. So they're going to support in the southeast, where there isn't another organisation, and in the northeast.
Okay. Is there anything else you want to say?
No, I'm just thankful for your interest in this topic, Darren, and it is important to mark World AIDS Day. But as people living with HIV, and I have Irish colleagues living with HIV, I've obviously colleagues in developing countries like this lady here, Sauda, in Tanzania, living with HIV, or Rwanda, she is actually living with HIV. For them, it's World AIDS Day every day. All of them don't want to see AIDS, they want to live positively on treatment. So thanks to the listeners, and thanks for your support, and wishing everybody a very happy festive season and all good wishes and good luck going into 2016. Thanks, Darren.
Okay, Breda, thanks very much. I'll be talking to you again, right?